The first thing Margaret lost was the word for colander. She was 73, a retired school librarian from Dayton, Ohio. She stood in her own kitchen holding the thing in her hands, and she could not think what it was called. 2 weeks later, she missed her granddaughter's birthday because the date had simply gone missing. Her family began using the word everyone dreads. They started rearranging their lives around a diagnosis nobody had actually given her yet. Here is the truth that almost nobody outside of medicine ever explains. When Margaret's daughter finally brought in a paper bag with every bottle from her mother's bathroom shelf, there were 11 of them. 3 were quietly working against her brain. Not one doctor had ever added them up. An estimated 7.4 million Americans over 65 are living with Alzheimer's disease right now. That number is real, and it is growing. But inside that number, there is a smaller group nobody talks about. And this is the group I want you to hear me on tonight. These are the people whose memory loss was never a disease at all. It was chemistry. It was a pill or a combination of pills that a doctor prescribed in good faith and a pharmacy filled without a second thought. And in many of those cases, it can be turned around. I'm Dr. John. I'm a board-certified internist. 28 years of clinical practice, more than 40,000 patients, and most of that career has been spent sitting across from adults over 60 who were told their mind was slipping because of their birthday. I need you to understand something. Sometimes it is, and sometimes it absolutely is not, and the difference is sitting in a cabinet 6 feet from where you sleep. Before we go any further, do something for me. Drop a comment right now with just your age and the number of prescriptions you take every day. Just those 2 numbers. I read every one of them, and what this audience tells me shapes what I cover next. We reply to every comment with personalized suggestions, so don't hold back. Today I am counting down 9 medications that research has linked to memory loss and cognitive decline in older adults. We go from 9 down to 1, and the ones near the top are the ones that surprise people most. Stay with me through all 9 because number 3 is the one I need you to hear. It was flagged in brand new research published this past year. It is handed out for ordinary back pain and nerve pain. And millions of older adults are taking it right now with absolutely no idea there is a question mark hanging over it. And there is one more thing. Somewhere in this countdown, I am going to tell you about a medication that gets blamed for memory loss constantly, in every comment section, on every health website. And the evidence says it is innocent. If you stop that drug on your own because of something you saw online, you could be trading a foggy afternoon for a stroke. Stay with me for that part too. Let's start at number 9. Number 9 is diphenhydramine. You know it as Benadryl. It is also the sleep ingredient hiding inside almost every product with the letters PM on the box. This is the little pill people take for allergies, for a cold, for a night they cannot settle down. It costs $4. It sits on an open shelf. Nobody needs a prescription. And so almost everyone assumes it must be gentle. Inside your brain, it is doing something entirely different. Diphenhydramine is what we call an anticholinergic. That is a long word for one simple idea. It blocks a brain chemical called acetylcholine. Think of acetylcholine as the ink your brain writes new memories with. Every appointment, every name, every conversation you want to keep gets written down in that ink. As we age, the brain produces less of it. There is less ink in the well. So a drug that blocks it lands on a 70-year-old brain with far more force than it lands on a 30-year-old one. You are not just writing with less ink. Something is now capping the pen. Here is what the research shows. A landmark study by Gray and colleagues published in JAMA Internal Medicine in 2015 followed more than 3,400 adults aged 65 and older for roughly a decade. Those with the highest cumulative use of strong anticholinergic drugs had about a 54% higher risk of developing dementia than those who used little or none. Diphenhydramine was one of the most commonly used drugs in that entire analysis. If you have been taking something to sleep every night for years, and you have noticed you are not quite as sharp as you were, I need you to stop calling that aging. Not yet. Not until you have looked at the label, and that is exactly what to do. Turn the box over. Anything marked nighttime, PM, or allergy relief is very often diphenhydramine wearing a different outfit. If you need an antihistamine, newer options like loratadine, sold as Claritin, or cetirizine, sold as Zyrtec, do not cross into the brain the same way and are generally considered far safer for long-term use. Never stop anything on your own. Bring it to your doctor. But stop assuming that over-the-counter means safe for your memory. Stay with me, because number 8 is one your stomach loves and your brain may be quietly paying for. Number 8 is the proton pump inhibitors. Omeprazole, sold as Prilosec. Esomeprazole, sold as Nexium. Pantoprazole, sold as Protonix. These shut down acid production in your stomach, and they are handed out for heartburn and reflux with almost no expiration date attached. People stay on them for 10 and 15 years because the moment they stop, the burning comes roaring back, which makes the drug feel like the only thing holding the line. Here is what nobody tells you at the pharmacy counter. Your stomach acid is not just there to give you trouble. It is the tool your body uses to pry certain nutrients loose from your food. Chief among them is vitamin B12, which keeps the insulation on your nerves intact. Turn the acid down far enough for long enough, and B12 can quietly fall. So can magnesium. And a B12 deficiency can cause confusion, forgetfulness, and word-finding trouble that looks almost exactly like early dementia on the surface, while the real cause is a nutrient your medication has been blocking. In 2016, Golm and colleagues published a study in JAMA Neurology examining more than 73,000 German adults aged 75 and older. Regular proton pump inhibitor users showed about a 44% higher rate of dementia diagnosis. Now, I want to be straight with you because you deserve accuracy more than you deserve drama. Later studies have not all confirmed that link, and researchers still debate whether the drug is causing harm or simply marking people who are sicker to begin with. This one is not settled, but the B12 problem is not in dispute at all, and it can be measured with a simple blood test. So, here is the move. If you have taken a proton pump inhibitor daily for more than a year, ask your doctor 2 things. Ask whether your B12 level has ever been checked, and ask whether you still need this dose or whether you can step down to an H2 blocker like famotidine, sold as Pepcid, which does not carry the same concern. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Number 7 is prescribed for something most people are too embarrassed to bring up. Number 7 is the bladder anticholinergics, and the name to know is oxybutynin, sold as Ditropon. Tolterodine, sold as Detrol, belongs here too. These are prescribed for overactive bladder, for that sudden urgent need to get to the bathroom that can reorganize a person's whole day and quietly shrink their world down to places with a restroom nearby. The relief these drugs provide is real, and so is the dignity they protect. I am not dismissing that for a second. But oxybutynin blocks acetylcholine, the same memory ink we talked about, and it crosses into brain tissue with unusual ease. It does more than settle the bladder. It parks itself in the place where new memories are made. Coupland and colleagues published a very large analysis in JAMA Internal Medicine in June of 2019, examining nearly 59,000 patients with dementia against more than 200,000 matched controls. Those with the heaviest exposure to strong anticholinergic drugs had about 49% higher odds of dementia. Bladder medications were among the drug classes showing the strongest signal in that entire study. And here is what troubles me. Almost none of those patients were ever warned. They were told a pill would settle the bladder. Nobody mentioned it might be dimming the lights at the same time. So, the fog gets blamed on age. The keys get lost 10 times a day. The thread of a conversation slips away. And everyone nods and says, well, you are getting older. You do not have to choose between your bladder and your brain. That is a false choice. Mirabegron, sold as Mirbatrix, and Vibegron, sold as Gemtesa, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they give similar control without the cognitive worry. Bring that up at your next visit, by name. Stay with me, because number 6 is sitting on millions of nightstands. Number 6 is the Z drugs. Zolpidem, sold as Ambien. Ezopiclone, sold as Lunesta. Zaloplan, sold as Sonata. These were marketed as the smarter, cleaner replacement for older sleeping pills. Different chemical structure, shorter action, fewer hangovers. And for a short stretch, they work. But here's the difference I need you to hold on to. Sedation is not sleep. These drugs press the off switch on your awareness. but they can suppress the deep slow-wave stages where your brain does its real housekeeping. Deep sleep is when your brain flushes metabolic waste, including the very proteins that pile up in Alzheimer's disease. Think of it as the night crew that comes in and cleans the building after everyone has gone home. Sedate the building deeply enough, and the lights go out, but the cleaning crew never clocks in. Research from the University of California, San Francisco, published in 2023, tracked about 3,000 older adults and found that frequent users of sleep medication had a substantially higher rate of dementia over time. In white participants, the increase was around 79%. Notably, the association did not hold in black participants, which tells us the picture is more complicated than a simple headline. The evidence here is not airtight, and I will not pretend it is. But these drugs are also on the American Geriatric Society list of medications considered potentially inappropriate for older adults because of falls, fractures, and next morning confusion. That part is beyond argument. If you take one of these nightly, do not stop on your own and do not stop cold. Ask your doctor about cognitive behavioral therapy for insomnia. It is a structured, drug-free program. It is available online and through most health systems. And in head-to-head trials, it beats sleeping pills for long-term results. It is the single most underused treatment in American medicine. Now here is where it gets really important, because I promised you a myth, and this is the one. Before we go any further, I need to talk about statins. Atorvastatin, simvastatin, rosuvastatin. If you search for medications that cause memory loss, statins will be near the top of almost every list you find, including lists made by other doctors on this platform. Back in 2012, the FDA did add a note about memory complaints to statin labels, and the internet has never let it go. Here is what happened after that. Researchers went looking hard, with much better tools. A large analysis published in the Journal of the American College of Cardiology in 2021 examined older adults on statins and found no increased risk of dementia, no increased risk of mild cognitive impairment, and no decline across individual thinking domains. Several reviews since have reached the same conclusion. Some even suggest that statins may be modestly protective, probably because whatever protects your arteries also protects the small vessels feeding your brain. I am telling you this because I have watched patients stop a statin over something they read, and then arrive in an emergency department 18 months later on the wrong side of a stroke. A stroke will take far more of your memory than any pill on this list. If you feel foggy on a statin, that is worth a conversation. Sometimes a particular dose or a particular drug does not suit a person, but have that conversation with your doctor, not with a comment section. You deserve the responsible version of this information. And that is the responsible version. Quick pause. If this is helping you connect the dots, take 1 second and tap that like button. It genuinely pushes this to more older adults who need it. And while you are down there, tell me how many prescriptions you are taking right now. I read every comment. All right, back to the countdown. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. Clonazepam, sold as Klonopin. These raise GABA, your brain's own braking system. At first, they can feel like a rescue. The panic unwinds, the racing stops, sleep finally comes. Over months and years, the picture changes. A study published in the BMJ in 2014 compared nearly 2,000 older adults with Alzheimer's disease against more than 7,000 matched controls. Ever having used a benzodiazepine was associated with about a 51% higher risk of Alzheimer's disease, and the relationship deepened with duration. Use beyond 6 months and longer-acting drugs like diazepam showed the strongest associations, likely because those drugs build up in fatty tissue, and the brain is mostly fat. What these drugs create is a slow chemical dampening across the whole brain. Learning slows down. Mental flexibility narrows. People describe a kind of emotional flatness, as if they are watching their own life through a window. The cruelest part is the exit. Stopping a benzodiazepine abruptly can bring rebound anxiety, severe insomnia, and in some cases, seizures that are genuinely life-threatening. That makes the drug feel indispensable at exactly the moment it may be doing the most harm. So, Hear this clearly. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly. Ever. Work with your doctor on a gradual taper, over weeks or even months. Buspirone can help anxiety without causing sedation. And again, cognitive behavioral therapy for insomnia is remarkably effective. There is a way out. It is just not a cliff. Number 4 is one medication prescribed for 3 completely different problems. Number 4 is amitriptyline, sold as Elavil. Nortriptyline belongs in this group too. This is an older antidepressant, and today it is very rarely prescribed for depression. It is prescribed for nerve pain, for migraine prevention, and very often just for sleep, usually at a low dose, usually at bedtime, usually with the reassurance that it is only a small amount. Underneath, it is one of the most powerfully anticholinergic drugs still in wide use. It blocks acetylcholine so aggressively that in older adults, memory trouble is no longer a rare side effect. It starts to look like an expected one. Amitriptyline was a major contributor to the exposure measured in that JAMA internal medicine study I mentioned, the one showing roughly 54% higher dementia risk at the highest cumulative doses. And notice what cumulative means. It is not about one pill. It is about 10 milligrams a night for 11 years. Small dose, enormous total. Nobody in that chain ever adds it up. There are alternatives, and they are good ones. For nerve pain, duloxetine may give similar relief without the anticholinergic burden. For sleep, melatonin, or a very low dose of doxepin, which is much gentler on this particular pathway. And for mood, modern antidepressants such as sertraline and escitalopram are generally considered far safer for the aging brain. Now, number 3. This is the one I told you to watch for, and it is the newest thing on this list. Number 3 is gabapentin, sold as Neurontin, along with its cousin pregabalin, sold as Lyrica. I want you to understand how enormous this one is. Gabapentin became one of the most prescribed drugs in America, largely because it was marketed as the safe alternative to opioids. It is prescribed for nerve pain, for shingles pain, for restless legs, for anxiety, for back pain, for hip pain, for almost any pain that lasts. Millions of older adults are taking it. Almost none of them think of it as a brain drug. It is entirely a brain drug. It works by damping down excitatory signaling in your central nervous system. That is the mechanism. And when you slow the signaling in a brain that is already aging, you may be slowing the very processes that encode memory. Here is the new part. A 2025 study published in Regional Anesthesia and Pain Medicine looked at adults with chronic low back pain and found that those who had received 6 or more gabapentin prescriptions had about a 29% higher risk of being diagnosed with dementia and about an 85% higher risk of mild cognitive impairment compared with those not prescribed it. An earlier analysis published in Frontiers in Pharmacology in 2023 found a similar pattern with both gabapentin and pregabalin. Now, this is observational research. It cannot prove the drug caused the decline, and chronic pain on its own is independently linked to cognitive problems. Any honest doctor will tell you that. But this signal is real enough that it changed how I prescribe, and your doctor may not have seen it yet because it is that new. If you take gabapentin, do not stop it abruptly because that can trigger withdrawal. Ask instead whether you are still taking it for a reason that is still true. A great many people are on gabapentin for a problem that resolved years ago. Ask whether the dose can come down. Ask whether a topical treatment, physical therapy, or duloxetine could carry some of the load. Stay with me, because number 2 involves medications people are given without ever being told what they are. Number 2 is the antipsychotics. Quetiapine, sold as Seroquel. Risperidone, sold as Risperdal. Olanzapine, sold as Zyprexa. These were developed for schizophrenia and bipolar disorder, and for those conditions they are essential medicine. That is not what worries me. What worries me is how often they are now prescribed off-label to older adults for restlessness, for agitation, for wandering, and very often just for sleep. Quetiapine in particular has become an unofficial sleeping pill in nursing homes all over this country. Very few families are ever told what type of drug it is. In April of 2024, the BMJ published a major study examining more than 170,000 adults with dementia in England. Compared with non-use, antipsychotic use was associated with increased risks of stroke, blood clots, heart attack, heart failure, fracture, acute kidney injury, and pneumonia. Pneumonia showed the largest increase, and the risks were highest in the first week of treatment. The authors concluded that the harms are more widespread than previously recognized. Since 2005, the FDA has required a boxed warning on these drugs about increased death in older adults with dementia. These medications suppress dopamine, which affects more than mood. It also governs focus, motivation, and planning. Turn that down, and a person becomes slower, flatter, and less present. And families watch someone disappear by degrees while the body stays right there in the chair, and they call it the disease progressing. If someone you love is on one of these, ask the prescribing doctor one direct question. Why was this started, and is it still necessary? Then ask about a supervised trial of lowering it. A great deal of the restlessness older adults experience traces back to something else entirely. Unrelieved pain, a urinary tract infection, poor sleep, too much noise, constipation, loneliness. Treat the actual cause, and the behavior very often eases on its own. And now, number one, which is not a single medication at all. Number one is cumulative anticholinergic burden, total load. You were probably waiting for one final villain. The real answer is much quieter than that, and that is exactly why most of this gets missed. Run back over the list we just walked through. Diphenhydramine, oxybutynin, amitriptyline. All three of those drugs block the same brain chemical, and an ordinary 75-year-old could easily be taking all three, prescribed by three different people who never spoke to one another. The allergist did not know about the urologist. The pain specialist had never heard from the pharmacy. Individually, each one might be a small effect. Together, they stack. That is what burden means, and it is why both the 2015 and the 2019 studies measured cumulative exposure rather than any single drug. It was the total that tracked with dementia risk, not the individual bottle. And this is not a rare situation. Today, more than 40% of Americans over 65 take 5 or more prescription medications regularly. That figure has nearly doubled in 25 years. Nobody owns the entire list. Everybody owns one line of it. Here is the hopeful part, and it is the reason I made this video. Medication-related cognitive decline is often at least partly reversible when it is caught early enough. A Cochrane review published in 2023 concluded that reducing anticholinergic burden through careful deprescribing may help prevent cognitive impairment or slow its progression. I have watched patients come back 4 months after a proper medication, cleanup, and tell me their family says they sound like themselves again. That does not happen with Alzheimer's disease. That is the whole point of knowing the difference. So, here is what I want you to do tonight. One thing. It takes 5 minutes, and it costs nothing. Get a paper grocery bag. Walk to every place in your home where medicine lives. The bathroom cabinet, the kitchen drawer, the nightstand, the purse, the glove box. Put every single bottle in the bag. Prescriptions, over-the-counter products, vitamins, supplements, all of it. Then put that bag by your front door. Bring it to your next appointment or walk it into your pharmacy this week and ask for a comprehensive medication review. Pharmacists provide these, they are often free, and Medicare covers them for many people. Ask one specific question. What is my total anticholinergic burden, and can any of it come down safely? There are scoring tools built for exactly that purpose, and most pharmacists have them. Do not throw anything away. Do not stop anything on your own. Just make the invisible list visible, because right now, nobody has ever seen all of it in one place. You have worked too hard for the life you have, to lose it to something nobody bothered to add up. Your independence, your stories, the names of your grandchildren, the road home. That is not a small thing, and I will not talk about it as if it is. Margaret, from the beginning of this video, is 81 now. Her daughter brought that paper bag in. We stopped 2 medications and switched a third. It took about 5 months. She is not 25, and neither of us pretends otherwise. But she reads, she cooks, she remembers the birthdays, and last spring she said the word colander with a look on her face I will not forget. That was not a miracle. That was arithmetic that finally got done. Now you know. Please do one thing for me. Share this video on Facebook right now and tag one person you love who is over 60. A spouse, a sibling, a neighbor who lives alone. Somebody in your life has that paper bag sitting in their bathroom and no idea what is in it. Your share may be the reason someone finally counts it. And if you are not yet subscribed, subscribe now. We are building toward 100,000 subscribers because that number is what tells the algorithm to put this in front of the next family sitting in a doctor's office tonight being told there is nothing to be done. Then drop a comment and tell me which of these 9 is in your cabinet right now. And tell me you will ask for a medication review this week. Say it in writing. The person who reads your comment tomorrow might be the one who needed permission to ask. This video is provided for educational and informational purposes only. This channel does not provide individual medical advice, diagnosis, or treatment. Several of the medications discussed today, including benzodiazepines, gabapentin, and antipsychotics, can be dangerous to stop abruptly. Always consult your physician or pharmacist before making any change to your medications. There is one thing I deliberately left out of this video. Your medicine cabinet is one place your body keeps its warnings. Your hands are another. Your fingernails can point toward your kidneys, your circulation, your thyroid, and your nutritional status, sometimes long before anything else shows up. Most people have never been told what to look for, and you can check it tonight in about 30 seconds under a good lamp. That is the next video, 4 nail signs worth checking before you go to bed. I'm Dr. John, stay sharp, and I will see you there.